Treatment with hypertonic saline, such as 3% sodium chloride, requires a delicate balance between effective treatment and avoiding complications. It is a crucial intervention in several neurological emergencies, such as impending brain herniation and symptomatic hyponatremia. For impending brain herniation, the recommended dosage is 3 milliliters per kilogram administered over 3 minutes, with the option to repeat once. This rapid infusion aids in reducing intracranial pressure by creating an osmotic gradient, drawing fluid from the brain tissue into the intravascular space. In cases of symptomatic hyponatremia, the treatment approach varies based on severity. Severe cases, characterized by seizures or coma, require 3 milliliters per kilogram over 10 minutes, potentially repeated once. For moderate cases presenting with altered mental status, headache, or vomiting, a slower infusion rate of 0.5 milliliters per kilogram per hour is advised. Careful monitoring is essential during hypertonic saline administration. Serum sodium levels should be checked every 1 to 4 hours. Treatment should be discontinued if serum sodium exceeds 120 milliequivalent per liter, or if the rate of sodium increase surpasses 0.5 milliequivalent per liter per hour. This precaution helps prevent osmotic demyelination syndrome, a severe complication of overly rapid sodium correction.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.